Hello everyone, my name is Stephanos. Welcome back to my channel. And today we are talking about hallucination, auditory hallucination, and brain receptor. So when we talk about hallucination, so it is like an internal thought signal here, and temporal lobe speech circuit activate, and brain interprets signal as someone speaking, and you perceive that voice. The dopamine role is the dopamine helps control how the brain decides what information is important. In schizophrenia, dopamine signaling may become too strong to certain circuits, so you will feel like, the information is too important, so you will have delusion, hallucination will come. This can cause the brain to get too much important to internal signal, make them feel like external event. So there will be medicine to help, like Abilify and Latuda. So all I talk about this will help you understand how you may choose to know if you want to have what kind of effect in your dopamine receptor. If you choose Latuda, if you choose Abilify, how the effect works. So let's talk about hallucination. Research think the process may look like this. It's like internal memory thoughts begin, speech production are activated, auditory cortex activated, like brain interprets signal as signal voice. So the brain generates thought internally, but misinterpret it's coming from outside. So this is the hallucination process. Okay. So in Abilify and in Latuda, Abilify and Latuda is working in different kind of brain receptor, which is let's talk about it right now. Abilify is receptor is dopamine D2. It's a partial agonist result in stabilized dopamine. So dopamine D2 stabilized dopamine is a partial agonist. But in dopamine D3 it's a partial agonist and the result is may affect the motivation and reward. Talk about Abilify, the other serotonin 5 is T2A. The action is antagonist, so it improves the antipsychotic effect. So it can help you like clearer thinking, that emotion blunting. Let's talk about Latuda. Latuda is the main receptor action is dopamine D2 is all antagonist. Antagonist, it blocks dopamine. In different kind of Abilify is not block dopamine. Abilify is partial agonist. This is brain receptor. Later we will talk about that in brain receptor and ligand work and brain cells work. We'll talk about it later. So in Latuda, serotonin and mood. So Latuda is antagonistic the serotonin and dopamine. The last one is serotonin 5 is T1A. It's partial agonist. Result in antidepressant effect. So what it means is it blocks dopamine. It's different kind of like Abilify and Latuda is very different. So Latuda is block dopamine signaling. So reduce the symptom of hallucination, delusion, diagnosed thinking, because block dopamine strongly than amplify, so some people feel calmer. But the key difference in Amplify and Latuda, the difference is it will make your thinking clearer. You choose Amplify. If you want to feel more calm and feel more suppressed of your psychologist's problem, you can choose Latuda. The brain activity, this is just my experience, but in scientists' research shows it's in more Amplify is in more balanced modulation. Latuda is stronger suppression. Okay, now we talk about the receptor and ligand. Ligand bind receptor. So when you bind receptor change the shape. When it's changing the shape, cell signaling change. The signaling is changing neuron activity change. Neuron activity change, so it will move, and your thought, mood, perception will change. So this is the receptor. It's talking about the ligand, right? So receptor activation about 20 to 30% signal. So when you use partial, when the drug is partial, the receptor is partial agonist, it is like 20 to 30% signal. Approximate. So if the dopamine level is very low, the receptor would normally be almost inactive. When the partial agonist bind, it will produce some activation. So it just gives you, with partial agonist, it just gives you 30% of activation. Okay, now we talk about high dopamine state and low dopamine state. In Amplify, when during the high dopamine state, it partial agonist replace to 30%. When the low dopamine state is partial agonist bind 30%. This is how it works in dopamine activity increase or decrease. Receptor in the brain, large protein embedded in neuron membrane. So the binding site, a shape can be changed. You can imagine like a flexible lock. When the ligand approaches the receptor, it attaches through the weak chemical forces such as hydrogen bond, electricity attraction, for van der Waals force, or hydrophobic induction. So we talk about receptor, we talk about ligand type, receptor and the receptor effect. Agonist is activated receptor. Partial agonist is weak activation. Antagonist is block activation. It's the previous thing that we talked about it. So, okay, so there's the other things we talk about. This is all we need to know about brain receptor. So the Latuda and Abilify, it's work on different kind of brain receptor and serotonin effects. So thanks for watching dopamine and serotonin receptor. Thanks for watching. My name is Stefanos, and welcome back to my channel. Hope you should like it and subscribe my channel for more science, medical, or experience. If you want to know more experience, welcome to subscribe my channel. Thank you for watching. See you next time.